Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Jerina Gani. She's a primary care physician. Today's Kevin MD article is My Journey to Loving Primary Care Again. Jerina, welcome to the show.
Thank you. And I'm very pleased and thankful to be here.
All right, so let's start by briefly sharing your story, and then we could talk about your Kevin MD article.
Okay, so I was born in Europe. I was born in Albania. It's a small country next to Italy and Greece, a Mediterranean country. I finished my medical degree there. Then I won a scholarship, one of the two actually, in Albania. So I was so proud of doing that. And I ended up doing a master degree in health services management in London, United Kingdom, back in 1994. I was there for a year. Then I went briefly to Milano for a short bit. My parents didn't want me to come all the way to America. It was so far for them. But my desire was to come to America. I don't know why. I always wanted to come here. Maybe it was my destiny. And I don't know when I think back. So in 1995, I ended up in New York City. And now I have to start struggling, work in many different places to become a doctor again, to unify my diploma. That was very difficult. I didn't think it was that difficult at the beginning. So I had to do different jobs. I had to work as a waitress, and I wasn't a good waitress to begin with because I never worked in my country before. Then I had to work as a travel agent. I worked in retail. And retail, I really liked it because I was connecting with people.
Yeah.
One of my favorite job, if I can mention it briefly, was working in Fifth Avenue at Bergdorf Goodman, the famous Bergdorf Goodman selling jewelry. And I had no clue when I got in that people were making so much money there. They were on commission and salary, and they were making, back in 2000, $200,000 a year. More than a doctor. I was supposed to be a primary care doctor, right? It changed my idea about medicine. Not that I didn't want to go to medicine because I love medicine, it was my passion. But I realized that, you don't have to be a doctor and think that you're so important. You're somebody, you can study, you can do your thing and learn from other people because there were so many educated people who work there.
Yeah.
And we're still friends today. And I did a research at NYU in cardiology, in the meantime, so I didn't want to go out of medicine. Finally, I did my training in Brooklyn. I ended up in Boston back in 2007, starting working in Boston as a physician in primary care.
All right. So just tell me that background, that story. You said that you love working with people. You worked in retail. How has that influenced you as a primary care physician today?
I think all these jobs I did in New York City, struggling to become a doctor, made me the best doctor I could be. Because at first I thought that I was privileged to be a doctor, and then I was seeing people from up down. I was thinking, I'm the doctor, they're the patients, whatever I say they have to do. After working in retail and dealing with so many people, different people, I realized that you are a person too and they are people too. So if you listen to their story better, if you communicate with them and connect with them, they will trust you more. Because even seeing a patient, I believe that is not just dealing with medical issue. If you're smart enough as a doctor and you have been working for many years, like me and you and many people that I'm talking to, you can deal with a medical issue in a second or in a minute. It takes some time, but you do it. But the connection is the most important part. And the words you say to that person who is sick, to make him feel better, that's very, very important. So in retail, I was making people feel good by selling them something that they loved. Here I'm trying so hard to make them feel good by saying a good word, not just taking care of their medications or their illness, but to connect with them and make them feel good when they come. My motto, if I can say it quickly, is that for every patient, I am the doctor.
Sure.
I may have so many patients, I have around 2,000 patients, but for every one of them, I'm the only doctor they take care of they deal with every day in their life. So I think that they're coming in my living room for the office, the exam room, right? And I'm there to welcome them. So I start always with a smile, no matter what, no matter how tired I am. I have to give them that smile because they feel so relaxed after that, and they can open up and they can, share their medical stories and other stories. I mean, we're privileged. They tell us so many stories. So we learn so much from life, because we become a psychiatrist, we not only a doctor. I mean, so many problems, as you may know, Dr. Foy, and everybody knows, we deal so much in primary care. But we can turn it into our advantage, I think, primary care, if we had enough time, if we organize our time.
Your article is titled My Journey to Loving Primary Care Again. For those who didn't get a chance to read your article, tell us what it's about.
Yes. So as everybody in primary care, I was working so many hours. I mean, I was working full time for so many years, And then it was no time for anything, no time for
Yeah.
my family, no time for myself, and no time enough for every patient to connect, to talk to them. I was like a robot because you have to take care of them in 15, 20 minutes. And then you have to deal with in between with no time in between. Your schedule is full, right? One patient after another. And in between, you have to deal with refills. You have to answer quickly any emails or phone calls, whatever. So I became a robot, honestly, like everybody else, so burned out. And at one point, I was thinking, do I have to continue this or do something else? Always in the back of my mind was that easy job in Fifth Avenue, selling jewelry, smiling to people, making all that money easy. But I love medicine. I didn't want to just betray all my patients. I had patients for so many years. So I said, I have to find a way to change this on my own. We know the system is broken, honestly, in primary care. So how can I change that to make it better? To be
Yeah.
happy to take care of patients and make enough money to satisfy myself and have some free time for myself and my family. At the beginning, it looked like impossible. But I took things on my own hands and I started speaking up. And I said to the people that I work with, the management, can I have, instead of 20 minutes every visit, can I have 30 minutes every visit? I know at the beginning, maybe everybody would think that I will make less money, right? But it wasn't the case because I was able to connect more with patients, to write better notes, to document better. And I was even making more money, but seeing them every 30 minutes. So seeing only 16 patients a day instead of more than 20 a day, 22 or 24, right? So then I said to myself, I can do this only for 3 days. How about I do this only Monday, Wednesday, Friday, and Tuesday, Thursday are my day off? Of course, we're in RVU business and a system, and many doctors are. So at the beginning, my salary was cut off.
Yeah.
I was making honestly over 300,000 working full time, if I can share that with the audience. And then I ended up at 220 to begin with.
Sure.
But I said to myself, I can do this. I can do this, right? So I started being very organized, managing my time correctly, documenting. I learned about RVU. I learned about billing. Billing is very important.
Yeah.
And I have a master degree in health services management, so that helped me manage my time right and realize what is important, what is not in documenting. Because I think that all our medical providers in primary care, we deal with so many issues, but we at the end don't have time to document what we do. And there we're underpaid. If you don't document, it looks like you're not doing what you're supposed to do, right? So you're billing less. If you bill less and not correctly, you're underbilling, you're getting paid less. So how can you document all that? You have to learn about billing.
Yeah.
This is, I created a course and I can talk later about it. And I explain in my course how to bill correctly, how to do it correctly. On the other side, if you connect with patients, they love you. They bring everybody, they bring their family. I mean, we're lacking primary care. We have the mother, the father, the children, the
Yeah.
grandchildren
Yeah.
as patients. And it's amazing. I think no other subspecialty or specialty has this privilege. If you're a cardiologist, you deal only with the heart. If you're a hospitalist, you deal 2 3 days with a patient. That's it. You don't see them anymore. We see them all the time. We have created a relationship with them. And the best, I feel so honored when a patient goes to a specialist, for example, cardiologist or GI, or they go to a surgeon, they have to do a surgery, and they don't decide for surgery unless they talk back to me as
Yeah.
their primary care provider. And I'm pretty sure many doctors have noticed this in primary care. They come back and they say, Dr. Gani, what do you think? Do I have to do this surgery? Is this a good doctor? What do you think? So I go over the note with them. I go
Yeah.
through pros and cons. This is the best compliment you can get in primary care. You're an advocate for them. So I was able to do this only by switching to part-time, working 3 days a week, and having the visits every 30 minutes. Otherwise, I didn't have time to discuss and, to be the advocate for them. And, to my surprise, I was able, even with 3 days a week, seeing only 16 patients a day, and I've done this for the last 3 years, I'm making over 300,000 a year. This is unbelievable. At the beginning, I didn't believe it, but it's true because I'm documenting properly. And I'm not overbilling at all. I'm billing correctly. That's very important because I'm ethical. I'm writing exactly what I'm doing with patients. And these are the things I want to share with all providers. And primary care doctors, but even nurse practitioners or physician assistants who are having now their own patient panel, because we know that we need so much help. We need
Yeah.
help in primary care. The new medical residents don't want to go to primary care. They don't know this part of primary care that is beautiful, and is a room there for improvement. And everybody talks about burnout, but it's not only that.
You talk about the importance of setting those boundaries. Like you said, you only want to see patients every 30 minutes instead of every 20 minutes, and you want to see patients 3 days a week. Now, when you set those boundaries, and by the way, I completely agree with you that we do need to set those boundaries, or else that's going to lead us to burnout if we don't. Did you get pushback from the administration or the powers that be? Because I know a lot of doctors who want to set those boundaries, administrators aren't going to agree, and they're just going to want their doctors to see as many patients as possible in as short a time as possible. Did you get any pushback when you set those boundaries?
I agree with you. You know, at the beginning, I had a boundary pushback when I decided when I was working full time to move from 20 minutes to 30 minutes. But I talked to them and I said, I'm so burned out. I have to do it every 30 minutes because honestly, it takes 5 minutes at least for a medical assistant to bring the patient in the office, as you know. So it's not 20 minutes. You end up with 15 minutes. What are you going to do more?
Yeah.
Patients come with a list of questions, right? So that was the thing. But I knew and I said to them, okay, fine, we'll see if I can make the same amount of money or less, but I cannot handle anymore. You know, and if you're a hardworking person, if you work very well in any company, they will honor that because they don't want to lose you. Wherever you work, if you're a hardworking person, they love you. They see how much patients love you. They can accommodate you slowly. Okay, so this was the first thing I did, working full time, but seeing patients every 30 minutes. Then I realized, oh, I'm making very good money. I'm making great money. So why don't I go 3 days? So I talked to them and I said, you know, I would love to work 3 days and I'll do my best to, you know, to make as much as I can. But this is my, you know, my thing. I cannot handle it like this anymore. So, you know, I was never afraid to speak up. Maybe because of the fact that I left everything in my country. I mean, I had a great life. Honestly, I cannot say that I didn't have a good life in Albania. I lived in the capital of the country and I had a master degree that nobody else had back in 1994, 95 there. And I left everything and started all over again as, you know, from scratch in New York City. So that made me more bold to ask because if you don't ask, you never get it. And many doctors are stuck in their, you know, in their place because they think they cannot move, they cannot ask, they cannot do. I
Yeah.
was never afraid because I started from scratch. I left everything in Europe. I came to New York City, a big city. I was nobody. Nobody cared that I had 2 degrees. They said, work as a waitress, do this. You have to, you know, survive. So that was the best thing that happened to me, to tell the truth. So if you can speak up and you're a good, hardworking doctor, nobody will replace you that easily. They will try to accommodate you. And I believe if they don't accommodate you, there is so many places you can go. If you're confident enough to ask for what you deserve, you know?
I talk to a lot of physicians who are scared of speaking up because they say that they will be labeled as a disruptive physician or not working as a team player. Now, how do you reconcile that perception with your experience in terms of asking for it in the first place? Because of course we don't get what we don't ask for. How do you reconcile that preconceived perception a lot of physicians have about speaking up?
You know what I think overall? Physicians don't have a community that they connect with because they're so overburned. They work so hard and they never talk to even each other. You know, so that's the main thing. If I could share, I mean, I'm sharing this through your podcast, and I cannot share this otherwise, you know, because I don't see these people. I wish we had a community that we can communicate more and people can get more empowered by other people who are doing it. Yeah, like in myself. I know that many physicians, many medical providers are still scared of asking. But what are you losing if you ask? Is my question. They're either going to say no or they're going to say yes.
Mhm.
And you know, if you ask, you realize how important you are for that company that you work with. So I don't think it's going to be the end of the world. You can ask politely. You don't have to be mean. You just ask that, and you know, if you're honest, and I notice that with patients too. If you're honest with everybody, they will appreciate. They will appreciate, you know, what you're saying, what you're doing, and they respect you more.
Now, when physicians talk to their administrators and ask them for whatever they need, some of the things that we talked about, do you have any tips for them? You said, of course, don't be mean, but is there a way of framing their ask so we can get administrators on our side and see things from our perspective?
Is the burnout. I mean, that's the biggest thing, and it's obvious. Everybody knows that all physicians are burned out in primary care.
Yeah.
We work so much, and everything goes to us. We have to check the mails, we have to check the emails, the phone calls, the paperwork we have to sign, labs we have to, you know, to send back the results. to deal with these perfect notes that everybody wants, So it's so much that we have. And I think without physicians, how a clinic will survive if the physicians are not happy, right? But physicians keep taking more and more and more into their, more burden and more burden without speaking up. This is not fair. This is not good. It's about time for them to do this in a nice way.
Yep.
That's the way I see. That's the way, I think you have to talk. You have to talk, and you have to talk again. It may not be the first time, you ask them and talk to them. You have to have the meeting face to face with them and express that you're totally burnt out, how this could be better. If you, I mean, that's the way I always did it in my life, and everybody respected that. I didn't have any pushbacks. I didn't. I was happy, and I'm still happy where I work because they recognized that, appreciated that.
Now, as a primary care physician, you said you see about 16 patients a day, every 30 minutes, 3 days a week, so less than full time. So, by implication, are you saying that it's very difficult to practice primary care in a full-time setting where you will have to see patients every 15 minutes? Because that is the position of a lot of primary care physicians today.
I totally agree. And if I knew this more before, I would have done it long time ago to see patients every 30 minutes. Because seeing patients every 15 minutes, you cannot document much,
Yep.
you cannot do much, and you're not going to get reimbursed much. If you see them every 30 minutes, you can document a lot more. You spend more time with them. Time is one of the effects of billing better, and you deal with more problems that they have. So honestly, I have calculated, and I've seen myself, if I see patients every 15 or 20 minutes in the same day, and I see them every 30 minutes, because in 30 minutes I can do all these annual wellness visits, I can do the physicals and the problems they have, I capture everything. The patients are very happy, I'm happy, and the finance department is happy because I'm making good money. So I think that 15 minutes should come out, shouldn't exist, shouldn't exist, honestly, because it's not a way to see people. We're dealing with patients, we're dealing with human beings. We're not, so it shouldn't be like a factory. Every 15 minutes you have to see somebody. Even when you work full time, I think you have to at least to go to 30 minutes, because as I know, and 5 minutes, 7 minutes it takes for a medical assistant to put
Yeah.
them in. So how are you going to see in 10 minutes a patient who has so many problems, and then you're going to cut them off? And then many doctors say, okay, 1 or 2 problems today, and then you come back again. They don't have room. In my schedule, people have to wait for months to see me because they never cancel because they're happy. Now they're very happy. I deal with everything. So this is better. It's better for me. It's better for everybody. So I think, in my opinion, that 15 minutes should not exist.
We're
That's my
talking,
opinion.
we're talking to Jerina Gani. She's a primary care physician. Today's Kevin MD article is My Journey to Loving Primary Care Again. Jerina, let's end with some take-home messages that you want to leave with the Kevin MD audience.
I have created a website called drganisecret.com where I share all my secrets through an online course, how to be successful with patients, how to be very efficient in working part-time or full-time, And that's the way I help many physicians, even nurse practitioners or physician assistants who have their own panel, to thrive in primary care. My wish is all of us in primary care can thrive, not get burned out, And my motto is work less, earn more in primary care, not vice versa. So this is my, saying at the end, my last word I can say to everybody in primary care in the United States.
Jerina, thank you so much for sharing your story time and perspective, and thanks again for coming on the show.
It was a pleasure.